Okay, so my name's Lee Spinks. I'm the admissions supervisor at UKAT and I've worked here for nearly 8 years now. Okay, so I work in the admissions office and my role within the company is to ensure the office runs smoothly for our clients, to take initial calls, to assess people, assess their needs, and actually look at suitable treatment options for them. From that point, we can go ahead and actually look at either treatment in a London clinic, which would be one-to-one services, or private residential treatment, and we have 8 clinics in the UK. We also do get people that will be calling us that are looking for local funded options, so we can assess and actually signpost to suitable treatment options in the local area that would be funded either through the government or through charitable organisations. I always think that this type of job is not the type of job you do just for money. I could go and sell sofas, but I'm in recovery myself. I came into recovery through treatment, and my life today is very, very different to what it was. And for me, it was an interest initially in helping people, and I still think that is there now. I'm very passionate about my own recovery. And I always think the best part of my job is that we do get to see people go through treatment, we do get to see people get their lives back, speaking to them after treatment and hearing the difference in them and hearing how their lives have changed. I think so. I think that my own experience of going through addiction treatment and trying to seek help is I would always respond better to people who had been through it, who actually hadn't just learnt it out of a textbook. They knew what I was talking about from personal experience. And for me it does. I can speak to the people. I think, a lot of people call and they feel absolutely hopeless. They've tried things, they never believe it's going to work, they never believe they can get clean and sober. And speaking to me, or a lot of my colleagues out there as well who have been through it, that can say, yes, you can do it, this is how we do it, and this is what life's going to be like in recovery. Coming out the other side, living a life abstinent of drugs and alcohol. They believe it's possible, and it really is possible to do. So I do think it helps. There's a few that will come across quite a lot. So a lot of the time it is going to be a monetary concern, from spending the money on rehab. How is it going to work, and how is it going to work ongoing for people? And I think that's really what I've seen, because I have worked for other providers, separates us from a lot of other providers. So the initial treatment we do is a fantastic foundation for people, and I'll always explain that on the phone about the therapy, the treatment and the recovery that we offer. But more importantly, I think, or just as important, shall I say, is the ongoing support that we offer. So the aftercare, we have psychotherapy for a year when people leave us, but we also have lifetime inclusion in our alumni program, and it really is just explaining it honestly. It's not, as far as I know, there's no cure for addiction. If there was, I would have found it and I'd be out there drinking and using normally. For me, it's about learning how to live abstinent, and that's the biggest concern, is the financial side, but also how it's going to work after treatment as well, and how are we going to keep people clean. I would say they're the 2 biggest concerns. I think mainly it's family members that contact us initially. They're very concerned about their loved ones, and a lot of the time it's a really big thing, isn't it, to actually ask for help. So a lot of the time the person that needs the help is going to get somebody to call, or just initial inquiries from family members who are concerned about a loved one. Of course, if they just want some information, even if they're a little concerned about some, maybe problematic substance misuse or alcohol misuse or other behaviours as well, because, addiction can manifest in many, many forms, they can give us a call and have a chat with one of us guys. When you're calling UKAT, so you are going to get to speak to a fully qualified admissions specialist, whether it be me or one of my colleagues. You will get walked through the process from start to end. I believe we can guarantee, after initial assessments, the best possible treatment within our clinics, in terms of the best possible foundation, in terms of therapy and recovery. And also, as far as I'm concerned, the most comprehensive aftercare program as well. it's not always about, I mean, a client may have a preference of where they want to go, but it's really about the client's needs. So in some cases, I mean, Sanctuary Lodge, we can take most clients into Sanctuary Lodge. We have nursing support there. We also, fully qualified therapist team as well. But in certain cases, somebody may call up for a clinic. We may not have availability. Then we can always look at another clinic, as in another lodge. Or there may be cases when a client calls up and they want a specific clinic and they're not suitable for that clinic. The unfortunate thing about addiction is in a lot of cases, and I understand this from my own personal experience, you wait until the very end before you seek help. So no one wants to look at their addiction and wants to look at getting treatment when it isn't that bad, because why would you? The drugs and the alcohol or even the behaviours are never really the problem, they're the solution to the problem. We treat the addiction. So until it gets bad, people aren't willing to change. So we may have to look at a clinic such as Bradford in Yorkshire that does have 24-hour medical care, and some people need that level of care because they're not suitable for standard rehab. We just have to ask questions. We have to actually assess the client over the phone. It's always looking at, about their needs in addiction needs, but also their actual medical needs as well, and actually assessing from that point where we can place them and where they're going to be suitable. We always send all of our contact details. We're always here to answer any questions and to sort of work on any fears that somebody may have. But yes, we set up regular support calls for people before they come in. But the nature of addiction means generally when people call up, they want something same day, next day, which we can accommodate and facilitate. Yeah, alcohol's always going to be the biggest one because it's socially acceptable, but ketamine use is massive in the UK. It used to be spice years ago. We don't really hear much about that anymore, but ketamine use is rife, and cocaine, of course, because cocaine's a very socially acceptable drug. It's like a rock star drug, isn't it? But yeah, we get a lot of people calling for that. I think the oldest person I've ever booked in was in their 80s. The youngest person is 16. The thing I think is a real positive in this day and age is I'm a child of the 70s, and I was brought up to never talk about feelings, emotions, certainly not addiction, and I qualified for help probably by the age of 16. But we didn't talk about that stuff. It was pull your socks up, get on with it, that type of attitude. In this day and age, people are talking about feelings and emotions, mental health and addiction at a lot younger age. So I think if you can catch people at a younger age, because addiction in its very nature is progressive, it's a chronic progressive, and if left untreated, a fatal illness in most people. Most addicts and alcoholics without help are going to die with a drink or a drug in their hand. So if we can catch it earlier, we can actually change people's lives for the better a lot earlier. Well, the thing with it, and I've never, some people's only option is to go down the NHS route. But I know, and this is again from my own personal experience, that it was very, very hard to access the help when needed. In certain cases, it can take, months and months, up to a year or more, and rehab's never guaranteed with them. UKAT do have, we have some more costly centres, but we have some lower cost centres as well. And I always think rehab is almost like a one-time deal. If you come in and you do the treatment and you do it as honestly as you possibly can and follow your aftercare programme, it's something that you never have to go through again, providing you follow your recovery programme. It's an investment in yourself. I wouldn't be alive now if I hadn't come into recovery. I'm a firm believer in that. My children won't have a father, so it saved my life. So I hear some things on the phone. It's like a prison. I've never been to prison personally, but I've been into prison to talk about addiction. They're nothing like prisons. It's like a hospital environment. They're very comfortable clinics where people are treated with dignity and respect. They're purpose-built rehab centres. So there is, people don't know what to expect from a clinic. But I know the staff. I know a lot of the staff personally in our clinics. They're absolutely fantastic, and they settle people in so quickly. So they would contact the clinics when somebody's with us. The admissions job doesn't stop when people go in, but our role is to actually arrange the admissions for people. Once loved ones are in treatment, they will be in contact with the clinic. We do also have family aftercare support that we provide for all of our clients, and that runs via Zoom with our psychotherapists. We involve the families as much as we can. So not admissions, no, but in our office we have a separate department called alumni. Now alumni are absolutely fantastic. Now they will set up regular support calls when people first leave the clinic, and they're very frequent when they first leave, and as people go on in their recovery journey they do go a longer time between the calls. But I think the good thing about alumni is that they do form a relationship, the alumni team and the ex-client, so there's always a point of contact if somebody's having a difficult day, because difficult days happen in recovery and you need to have that support around you. When people first call, it's going to be an initial assessment with somebody over the phone, whether it be the client, the person that needs the help that's calling, or a family member. So we'll assess, gauge somebody's needs, suitability for, whether it be residential treatment or outpatient treatment with us. Following that point, we can then start looking at clinics. Now, as I said, we can arrange admissions within 24 hours, usually of call, in certain cases same day if people are really in desperate need of help. So at that point, once we've started looking at clinics, we would then move on to the actual booking of the treatment. So if we were looking at residential treatment, for example, it would be a case of looking at the clinic they were going to, admission times. At that point, we've already assessed their suitability, so we would process a deposit to book the treatment bed and actually get the doctor booked for the day of admission. Then full assessments are done with the client. Now they have to be done with the client because we need to know exactly what's going on for the person. We will also request medical information as well to be emailed from the GP, and that usually is just a phone call to the doctor's receptionist. We get all of that over to our doctor to review. Our doctor will then pass the admission, clear the admission for the person to come to us, and then they arrive at the agreed time and date. Once they get into treatment and they're actually there, all of the aftercare is put in place when they leave the clinic. I'd say it is only a phone call. To reach out and ask for somebody for help. It is only a phone call. The worst that's going to happen is you're going to speak to us and you're not going to like what you hear on the phone, as in you're not going to be willing to access treatment. The best that's going to happen is you're going to hear something that could change your life. It isn't a weakness to ask for help. Addiction is not a weakness. It isn't a moral failing. It isn't a slight on somebody's character. Addiction is a recognised illness, and as I've said before, it's chronic progressive. So just take that leap of faith and reach out and speak to somebody. You might hear something that will change your life.